right, ladies and gentlemen, once again, welcome, all right, to watching our show. We are now live in One Utama Shopping Center right here at the Advanced Primary Eye Care brought to you by Focus Point from 27th of April all the way until 7th of May 2023 right here at the ground floor center court. All right, because we are having this Facebook Live right here, so we want to tell you the importance of your eye, because as I know that the awareness of the public in terms of eye is like very, very low. So the purpose of this Facebook Live is to increase the awareness among the public. And today, all right, at the first session of today, we are actually talking about the importance of regular eye pressure check. So I think that everyone is just like me, because we don't know what is eye pressure and how eye pressure actually affected us, all right? That's why we are having this professional right here at the Facebook Live. So now without further ado, we would like to invite the Deputy Dean, Faculty of Optometry and Vision Sciences of SEGi University and Colleges, Dr. Kiang. Hi, Doctor.
Hi.
All right, so Doctor, say hi to the Facebook Live viewers and also the public in One Utama Shopping Center.
Hi everyone, I'm Dr. Fu here. Hopefully today you can share with you some of the information related to the eye pressure checks. All right.
So I believe that actually Dr. Fu is really experienced in optometry industry. So first of all, you would like to ask Doctor, in your point of view or from your observation, so how is the awareness level in Malaysian among about eye pressure?
I think that it is quite low as compared with other countries. All right, but it's becoming better and better now. More and more people that actually know that you need to have regular eye checks, and checking eye is more than just get a pair of glasses. All right, so more and more people know, and more places actually provide services that in a way that provide you more eye testing rather than just give you glasses.
Yeah, like from what doctors say, the awareness is very low. So for those who want to know more or who want to spread the information to your friends and family, don't forget to give us a like, comment, and also share this video to your friends and family and also relatives. And those who have questions about the eye pressure, you want to ask doctor, you may actually just comment below. So after that, we have a Q&A session to ask doctor about the eye pressure and about your question, all right? And I believe today, Dr. Fu do have some slides to share to the Facebook viewers. So don't forget once again to share the Facebook to your friends and family. All right, Doctor?
All right. Okay, thank you. Shall we have?
All right, so we are having this technical issue currently. All right, so those, once again, ladies and gentlemen, those who want to ask more questions, you want to know more about eye pressure, you may actually just share this Facebook, all right? And also don't forget to comment, all right? So before we move on to the slide, we want to ask Doctor. So because the eye pressure is like really a very crucial thing in Malaysia. So actually, to the layman term, what is eye pressure?
The eye pressure basically is something which is just like you have like blood pressure. You have to check the pressure inside your blood. Eye pressure basically is the pressure inside the eye, which is also telling you that to maintain the eye shape, to maintain the healthiness inside the eye, the pressure need to keep at a certain level. If you have too high pressure, of course, it can cause damage to the nerve inside your eye. All right. So now we start here. Everyone said would like to have your eye examinations. So every time, when you talk about eye examinations, sometimes a lot of people think that eye examination basically just check power like this. All right, to go to the optical shop, check your power, get a pair of glasses. Or sometimes some people don't even want to have a proper eye check because they think that too long times to take. So probably they just want to go through machine check, and if a machine come out that your eye power is low, it's fine. So I don't want to proceed further from there. Or some of them think that eye examination should involve checking internally or externally of the eye, look carefully, is there any sign of disease, whether your eye look healthy or not. So some of them actually think that eye examination should cover more until ocular health. So now, but for an practitioner or optometrist, usually someone that come to our place to have eye examination, usually we need to make sure that it must cover these 4 sessions. First thing is we want to know your visions. How good are your visions? Whether you wear glasses or with contact lens, we have to make sure that with the correction glasses, you must see perfectly, must have a good vision.
So, Doctor, the vision part is like referring to the power of our eye, right?
Not just the power, we are talking about with your correction glasses, how good you can see.
I see.
So that is first thing we want to know, how good you can see with your current glasses. All right, and after that, we will proceed to check your eye power. So with the eye power corrections, and how good you can see, how best the eyeglasses actually can correct your eye. So that's why these are the two things here. It means that at least we want to know how good you can see. Second, we want to know that whether you are short-sighted, long-sighted, or you have astigmatism, at least we want to know your refractive status. All right. And now the third thing is we want to make sure that you're actually using both eye together. All right, because there are people that which is a squint eye, the eye actually divided. So these are the person that which is we want to detect as well, to see anything that can be done in order to make sure that they see both eye. Because using both eye together, it gives you better depth perception, so you can see the 3D movie better. All right.
Doctor, I have one question, a very layman question.
Yes.
All these 4 eyes examination we can actually done by one machine or in different machines?
No, of course, it's different machine because when you actually have your eye check, these are the things that we need to determine. And the last part is we need to determine whether your eye is healthy or not. We cannot just assure that you assume that you actually see clear. That's all. Your eye is healthy. Not necessary. A lot of people that actually their eye is healthy, eye can see clearly, but it's not healthy. All right. So that's why we have to make sure that it's cover all 4 components over here whenever that you have eye examinations. All right. So now, under eye health here. So they have many ways, actually, there are many ways for you actually to make sure that someone is actually healthy or not. So there are many instruments, many methods actually to have eye examination. One of the examination is called tonometry. All right. So the tonometry is basically to check, test that to measure the eye pressure inside your eye. All right. So usually the eye pressure inside eye, we call that intraocular pressure. In short, we use IOP. Usually we use IOP because the eye pressure is very important. But if you have increased eye pressure, they definitely can damage the nerve inside your eye. All right. So why we want to perform this tonometry? Why we want to measure the pressure inside the eye? So because basically the one thing is we want to rule out whether you have any sign of glaucoma. All right. So glaucoma can see the picture like that. In Chinese, we call it 青光眼, yeah, 青光眼.
So actually, the glaucoma, or we call it 青光眼, is it quite related to eye pressure?
Yes, because long times ago, of course, if you really look like this, it's very, very bad advanced
very
stage.
Serious already,
very serious already. So now we do not want to wait until this stage, only tell you that you have 青光眼. It's too late to do anything. So usually we want to have early detections. All right, so we don't want to wait until this stage. So that's why eye pressure check is one of the way that actually to see whether is there any risk that you have glaucoma or not. All right, so that's why now to understand that you need to know what is glaucoma. All right, in general, of course, glaucoma, they have many types. One is the most common type is basically it is a chronic eye disease. Chronic eye disease means that it is a slowly actually affecting your vision. All right, it's a disease that which is not like sudden. Of course, they also have a sudden type, but that is not common. And it basically is damage your optic nerve. All right, and one thing that you must know is it can cause you have serious vision loss, and it is irreversible blindness. This is scary part. It means that they can damage your nerve, and whatever that you do after that is no way that actually to give you your visions back. So that's a scary part. That's why early detection is very important.
Doctor, talking about the early detection, because
Yes.
we know that the eye pressure, normal eye pressure is very important.
Yeah.
So how do we define the normal eye pressure?
That is a bit difficult. They don't have a clear cut-off point on that. So because the eye pressure doesn't mean that which is you actually have certain level of eye pressure, you have glaucoma. No.
Oh.
If you're actually looking at, you can see the definitions of glaucoma here. It never mentions eye pressure over here. It's only one thing that you notice. If you have eye pressure going up and up, that means the risk of you having glaucoma is higher and higher. But they do not have a clear cut-off point that you're up to certain level, you have glaucoma. And below that, there's no glaucoma. No, you only say that higher pressure you have higher risk to have glaucoma. All right. So that's why this is something that which is we want to know. We actually can monitor the risk to assess whether you have the risk to have glaucoma and try to actually reduce the risk. That means lower down the pressure, it basically reduce the risk of you having glaucoma.
Because you're talking about the high eye pressure. So do we have low eye pressure?
Yes, we will touch about that later.
All right. Looking forward to it.
So one thing that you need to know is the glaucoma usually is actually have no symptom. That's the scary part. They have no symptom. Your pressure can be high in a way that which is not until you feel pain. They will have one level that which is one type that you can be very high until you feel pain. That is the acute type. So that usually is quite dangerous. That usually you need to get treated as soon as possible. But the common type is the one that which is actually is high. That in the way that which is still do not until the level that will cause symptom. So that's why the glaucoma is called the silent thief of sight. It slowly actually causes you have vision loss without causing any symptom. All right. So that's why regular check is important. All right. And it definitely will cause damage to your nerve if your pressure is too high. Now, according to the this world report of vision based on from WHO, it shows that glaucoma, there are estimations that they have 76 million of people that in the world that are actually having glaucoma. All right. So it shows that 40 to 80 years old of age will have glaucoma in 2020. That's according to the estimation of WHO. All right. There's a big number there. And then they also show that at least 2.2 billion of people that are actually blind in this world. All right. And at least 1 million of them, among these 2.2 billion, 1 million of them actually, it can be actually treated or prevented. All right. So all this disease that which is actually can be prevented is shown here. All right. It's just like cataract, glaucoma, there are diabetic retinopathy. All this actually can be prevented. All right. So that's why today we'll try to look at glaucoma. There are 6.9 million of people that actually it should be prevented from becoming blind because of glaucoma. All right. So early detection is very important. And another scary thing is the number of people that are having glaucoma is increasing every year. All right. So estimated it's become 111.8 million people that will have glaucoma in 2040. All right. The number keep increasing. And if you look at the prevalence, it means that the number of people that are actually having glaucoma, it's called a common primary open-angle glaucoma. All right, it's about 3.05%, 3.05%. All right, so it's just telling you that out of 100 people, 3 to 4 people are having glaucoma. All right, so we try to make sure that there are less and less people that actually have glaucoma and can be treated.
So, doctor, this is in the global.
Yes.
Right? How about in Malaysia? Do you have this research?
Here.
Oh.
In Malaysia, of course, we do not have a quite comprehensive research done in Malaysia. So this research has been done many years back. It's only showed that, I think 2014, the research has been done. And it showed that it's 1.2% of Malaysian population actually is blind, all right, legally blind. So out of this 1.2%, is actually 6.6% actually are having glaucoma, blind because of glaucoma. They are blind because of glaucoma. So 6.6%. But based on my roughly calculations, assuming there are 30 million Malaysian populations, this means that there are about 23,000 of Malaysians actually blind because of glaucoma. All right, and this number, of course, will be even higher than that. This is just estimations.
Okay.
All right? Okay. So that's why they need to know very well how to actually detect glaucoma and how to prevent that become blind. All right. So if you look at here, how's the eye pressure related to glaucoma? Because we know that in order to maintain normal, healthy eye, inside the eye have fluid. All right, the fluid inside the eye actually provides certain pressure inside the eye. So the fluid actually they have new fluids that produced, and then they have old one will be flushed out. All right. So, but whenever they have some blockage in this drainage, so that's why the pressure will go up. The fluid cannot be drained out. So it's slowly the pressure inside the eye will increasing. So when it slowly increase, usually it won't cause any symptom. You won't feel pain. The pressure is slowly going up. So they can actually cause damage to the nerve if it actually help eye to a certain level, all right, without any symptom. So that's why glaucoma is something that which is you wouldn't have any symptom unless you go for a proper check. All right. Oops, sorry. And one thing that we know, if we are talking about primary glaucoma, so they actually do not have identifiable causes. That means we do not know what is the cause that actually causing you having glaucoma. We do not know what is the main cause. We only know that actually the risk. What are the risk factors? So it means that when you have this kind of risk, the chances of you to have glaucoma is higher. All right. So among all the risks here, of course, there are because of aging, because of you have family genetics related, and then you have diabetes, or you have high myopia, so that means high short-sightedness, or one of the risks high is which is we say that these are the only risks that actually can be modified, can be reduced, which is eye pressure. All right. So we know that if your pressure going up, the chances of you having glaucoma is higher. So the only way that actually to reduce the risk of having glaucoma is to reduce your pressure. All right. So that's why checking your eye pressure is important. If too high, definitely it's good to bring it down. All right. So, but who are the one that should check the IOP? It's not usually it's not everyone that must check. All right. But we usually looking at the one that which is high risk to have glaucoma. That's why people that 40 years old and above, or people that actually have risks, such as they have family members that have glaucoma, or they actually have very high short-sightedness. These are the people that usually have high risk to have glaucoma. That's why they should have their eye pressure checked when they have eye examinations. All right.
So doctor, actually, how frequent should they go and do the eye check for the high-risk group?
So that's why if you have high risk, usually you have annual eye checks, all right, you should be all right. That means to check the pressure as well. But of course, they need to have other tests as well. We'll touch on that as well.
All right.
All right. So, but first thing is how to actually check your eye pressure. So in the centers, or even the what you call optometry center, even the optical shop, some of the places that actually they have these instruments for normal eye pressure checks. Some of these actually we call non-contact tonometers is good enough. All right. So we have this actually using air, the pulse air. They actually have air actually blow to your eye and try to actually they can actually estimate what is your pressure. All right. So for normal eye check, this actually is good enough. For normal screening, this is good enough. All right. And of course, they also in the market they also have this actually they use a probe. There's a tiny probe that which is disposable probe, and kind of actually hitting your eye, but you won't feel anything. It's quite safe and no pain. All right. So it's very easy to get the result instantly. All right. And this one can easily done in the center as well. And of course, this one usually been done in hospital and they need to have local anesthetics. All right. So usually this one is more because it's a gold standard. Usually people at the hospital will do this. If you really suspect glaucoma, they actually have to do this test. All right. But this one they put anesthetics because you need to touch your eye. All right. So to make sure that which is the pressure can measure properly. All right. So now, according to this, what happens in pandemics is there are research coming out that which is using this air to shoot your eye in order to measure pressure, they actually increase the risk for COVID transmissions.
Yep.
That's why nowadays you can see that this method is seldom been used already. All right. Okay. Just to avoid the COVID. All right. So now, why we need to check your eye pressure regularly? It's not like checking one time. That's all. All right. So you need to check regularly because your eye pressure can change. Even in a day, they can be up and down. They will change. There are many factors that can change your eye pressure, and because it can be between. You can squeeze your eye hard like that for 15 seconds, and then the pressure will go up as well. All right. So it's like eye movement, your head position, body position. You have very tight necktie. Also, that also can cause your pressure change. So that's why there are many factors. Even blood pressure actually can change your eye pressure as well. So that's why your eye pressure will fluctuate. All right. So that's why you need to check regularly. And even they have research have done also, they monitor 24 hours. It shows that your pressure actually will go up and down. Usually evening time it will go down, morning time it will go up. So the pressure actually will go up and down. And even within a day, normal people, they were about 5 millimeter. That means they will be fluctuate. But the glaucoma patients, they will fluctuate more. All right. So that's why it's recommended to have regular checks. All right. And also, you also show that here as well. Even though the progression is not that steep, but it has shown that when you grow older, your pressure actually slowly go up as well. All right, even be very slow pace lah. But it's just telling you that the older you are, it's always good to check your eye pressure as well. All right.
So does this mean that when you are getting older, for example, you are 80 years old, you check twice a year, will it be better? Or just once a year will be good?
It's not necessary. We have to see whether you have any other sign as well. Because we cannot just purely base on the pressure. That's why I will talk about here. Is the eye pressure is good enough here? All right. Because you just cannot rely on checking pressure. Of course, checking pressure is easier. All right. But when we check the pressure, and at the same time, actually, you're supposed to do other tests as well to make sure that the risk or the sign of glaucoma is not there. All right. So now, the thing is, there are many people that actually are having glaucoma. If you look at particularly this side, there are people that are having normal pressure, but they are glaucoma patients. This kind of glaucoma is called normal tension glaucoma or low tension glaucoma. So that's why we need to rule out this type of patients as well. So it doesn't mean that your pressure is low, normal, you're safe. All right. So it's always good that which is to further check. And they also show that research show that you can see particularly the red color sign that there are people that which is glaucoma, but their pressure actually low. Usually they use a 21 millimeter mercury as a cutoff point, but they show that there are many people that below that level, they still having glaucoma. So that's why we still need to make sure that these type of people can be checked as well. All right. So, and research show that they are among the patients that are having glaucoma, at least there are about 40 or more than 40% of people that can be low tension glaucoma, and it's getting more and more. And especially in Asia country, the patients that are having low tension glaucoma is high, especially. All right, it can be high and to 80-90%. In Japan, they reported that it's very high percentage of people that are having low tension glaucoma. All right, so that's why to make sure that you do not have sign glaucoma, besides checking your pressure, you always advise that you have your internal eye check as well, internal eye health check as well, to make sure that inside we can see your nerve, your we call it optic nerve, it look clear. That means it's normal. We do not want you have the nerve that look like the glaucoma patients here. So glaucoma patients' eye will be looking at on left side, my left side, and the right side is a normal.
So this is the glaucoma one. So
Yes.
this is a normal eye.
Yes.
All
so
right.
That's why we look at the backs of eye. At least if you have signs showing something like that, we know that you could be having glaucoma, even though your pressure is actually low. All right. And of course, if someone that we suspect that they have sign of glaucoma, we always want them to check this visual field. It means that to see how wide the area that they can see. All right, because glaucoma patients also, they will show certain area they cannot see well. The sensitivity to light at a certain area will not be good or not normal. So by doing this test, we actually can detect whether you have glaucoma as well. All right, and of course, nowadays they have more advanced equipment that which is actually to scan your eye, to look at the layer inside your eye, layer by layer, to look at the thickness of your nerve. That will be more sensitive to test glaucoma. But this will be more advanced. Of course, it's costly as well. Not everyone that actually will want them to do this test. Only the one that which is do certain sign, the pressure or the back of the eye, they look like they have sign glaucoma. Then we will advise them to do this test. All right. So there are many tests actually you should actually proceed in order to make sure that you are clear from glaucoma. All right. So now, basically, in conclusions, someone that is 40 years old and above, if you have family history of glaucoma, family history means that your parents, your sibling have glaucoma, or you have very high short-sighted. It means that your power -6 and above. So you definitely is advised to have your eye pressure checked regularly, all right, at least annually, all right. So that's why regular checks of eyes is important. It definitely can save your sight. All right, okay, that's what I want to say. Thank you.
All right, thank you so much, Dr. Fu, for the very wonderful sharing. So I believe that all of you might have a very, very initial idea about the high eye pressure. All right, about the glaucoma as well. All right, so now we will proceed to the Q&A session. The first one will be, I received an inbox, all right. They say that, can doctor tell the netizen or the Malaysian, what is the main cause of getting like high eye pressure? What is the main cause?
If you're talking about high pressure, most of the time that you can see from the slide previously, is mainly because of drainage blockage. All right. So if the drainage blockage, your fluid inside your eye cannot be drained out. So that's why the pressure will go up. All right. So of course, there are glaucoma that which is because of other reasons, causes, just such as like you have incident, you have injury of your eye, so which is injured in a way that which is blocking, cause your drainage that which is clogged out, or someone that which is have inflammation inside the eye, they have infections, and then they have what I call cell inside the eye, so one that block out the drainage. So they can have other disease that which is causing you having glaucoma as well. But the common one which is do not have symptom, we do not know actually what is the reason. We just know that which is your pressure is going up. Sometimes we do not know why. All right, the only way that we can do is actually bring down your pressure. That's all.
All right, as from the chart shown just now, meaning that the older you are, the higher the eye pressure it will be.
Yes.
All right. So
it's possible. That means it's not a very drastic change, but it's just slowly progress.
So what about for those who are under 40 years old? So is it possible for them to get a very high pressure or high eye pressure?
It happens as well. It doesn't mean that which is below 40 will not have glaucoma, but the chances of people that 40 and above is higher. Below 40 is lower, but patients that which is actually, I have seen patients that young patients that which is actually can be genetically, they're born with something that abnormal feature inside the eye, that they're born with glaucoma. They also have patients that have high myop. They are very high power, and their sibling have glaucoma, the parents have glaucoma. So and now that they're 20 over years old, they already have glaucoma as well. So these are people. So it doesn't mean that which is you have to be old enough when they have glaucoma. So it depends on what are the risks that you have. All right, whether your family history or whether you have high myop. Of course, higher, that means you have higher risk. The chances to have glaucoma is higher. So you need to, don't wait until you're 40 years old only you check. All right.
All right. Because they are like blue collar and also white collar like us. All right. We are regularly very facing the laptop and computer. Is it one of the increase the speed of getting this high eye pressure?
No, for me, I don't think so. So far, they don't have a researcher actually talking about you look at the screen more and then getting the pressure high. No, it's temporary, it's possible. All right, but it's not actually long-term effects. All right, so it's basically if you have just spend more time in your work, that actually causing your eye tired and dry eye, and of course it strain your eye. But it's because you look at screen more and cause you getting glaucoma. I don't think so.
I see. So if our eye pressure remain at a very high level, like at most of the time, so what is the effect?
If let's say the thing is they do not have symptom, so it means that when your pressure high is in a way that which is you're talking about slightly higher than the average, so usually you do not have any symptom, you don't feel anything, but the problem is your nerve may slowly damage. But if you're talking about your pressure go up very, very high, yeah, of course you're going to have acute glaucoma, that be your eye going to be very painful, red, and definitely you need to get admitted into a hospital as soon as possible. That is possible if your pressure is go up very, very high.
I see. Okay, for the last question. All right. So can you please tell the Facebook viewers to how to take care of their eye in your professionalism?
Okay, so it's to take care of eye basically, it's the first thing is you have to make sure is have your regular eye checks annually at least, all right? But it's of course depends of whether you have any eye problem. If let's say you have diabetics, of course you have to advise to have every 6 months eye check. Or even you have family history of glaucoma, so it's always good that actually every 6 months to have your eye checks. But if let's say you're normal, fine, you're clean or any risk, so usually it's annually have your eye check is good enough, all right? But of course, always take care of your eye. You only have one pair of eyes. So don't be afraid actually to get your eye checks. All right.
All right, if you want to do an eye check, as like what Dr. Fu said, you may actually come here to the One Utama Shopping Center center court or ground floor, because Focus Point will be having this free eye check for you until 7th of May 2023. So don't forget to come here, and then don't forget to like this live. Also comment, and also don't forget to share to your relatives, because this information is really, really useful. All right. So once again, we would like to say thank you to Dr. Fu,
Welcome.
Deputy Dean, Faculty of Optometry and Vision Sciences of SEGi University and Colleges, to share us really, really useful information. Thank you, Doctor.
Thank you for having me.
And for those who are actually watching our live, don't forget that to stay tuned, because we will be having another session at 3:30 p.m. later, right here live at One Utama Shopping Center. All right, we are hoping that you can drop by here to visit our event, which until 7th of May 2023. So don't forget to stay tuned. We hope to see you later on. Thank you.
All right. Thank you.